Well, facial aging is a complex process. It involves both genetic and environmental factors. Some of the genetic factors we can think about are fairly obvious in the sense that we tend to age like our parents. In other words, if our mom started to get sagging cheeks in her late 40s, or dad got baggy eyelids at 55, there's a good chance that we're going to show a similar aging pattern because we share genetics with our biological parents. Now, there are other factors that also contribute to aging as well, and those are environmental. For example, if we're smokers or we have an extensive amount of sun damage, we well know that those two factors will damage a lot of the proteins in the skin, like the elastin that allows sort of smooth recoil, and we can end up with a lot of wrinkling. Just think about the last person you saw with a deep, deep, deep dark tan who's about 60 walking down the beach. They look a lot different than someone that hasn't had as much sun damage. Or think about the wrinkled smoker that looks very, very aged because of that process as well. Now, when we compare ourselves to Jane, it's certainly possible, of course, that Jane has completely different genetic background or age in a different genetic background, which allows her to age at a different rate. It's also possible that she's had a lot less exposure to sunshine than we have, and as a result, we look different. It's also important to focus on the fact that aging is not always a linear process. So in theory, Jane might still look older than us at some point. And the reason being is if you think about people that you know, sometimes you haven't seen someone for about 10 years and you look at them and they don't look like they've aged at all. And all of a sudden, over the course of the next 12 months, they really look like they've changed. And that's because, as I said, there's a non-linear process to aging in many cases. So for long periods of time, we can look relatively unaffected by the aging process, and then dramatically that changes. But in some, it's a strong combination between both those environmental and genetic factors.